This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Uterone 100mg injection 2 ml supports early pregnancy and reproductive health. It is essential for women facing issues related to progesterone. Indications and uses. This injection is primarily indicated for the maintenance of early pregnancy, especially in women who have a documented history of repeated miscarriages due to luteal phase defects. It is also used as an adjuvant in infertility treatments such as IVF and GIFT to improve the chances of successful implantation. Furthermore, it helps manage threatened abortions and abnormal uterine bleeding caused by hormonal imbalances. Additionally, it serves as a diagnostic tool in progesterone withdrawal testing to assess the endocrinal causes of secondary amenorrhea among women facing infertility challenges. How it works. Uterone 100mg injection works by supplementing the body with progesterone, essential for the successful implantation of fertilized eggs and maintaining early pregnancy. Directions for use. Uterone 100mg injection is administered by a qualified healthcare professional, either through intramuscular or subcutaneous injection. The exact dosage and duration depend on individual factors such as age, body weight, and specific medical conditions. Patients should not attempt self-administration and must follow the healthcare provider's instructions closely to ensure safe and effective use. Possible side effects. Common side effects associated with this injection include pain, redness, and swelling at the injection site, as well as headaches, nausea, and changes in mood. It's essential to monitor these effects and consult a doctor if they persist or worsen. Precautions and warnings. Before receiving this injection, it is crucial to inform the healthcare provider of any existing health conditions, particularly liver, kidney, or heart issues, as well as any history of blood clots or cancers. It is contraindicated in certain populations, including those with specific hormonal cancers or during breastfeeding. Caution should be exercised in patients with asthma or other respiratory conditions. FAQs. 1. Does Uterone 100mg injection cause weight gain? Yes, it may cause weight gain in some individuals. 2. Can it make you feel tired? Yes, tiredness is a common side effect. 3. How is it administered? It is given by a healthcare professional as an intramuscular injection. 4. Who should avoid it? It is not recommended for women with ectopic pregnancies or those with certain cancers. Thank you for watching. Please feel free to leave a comment if you have any questions or suggestions. Your feedback is appreciated.